Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain-Free with Dr. Marc Darrow from the Joint Rehab and Sports Medical Center in West Los Angeles. This is the program that can give you effective solutions for the pain that you've been living with. Dr. Darrow is a medical doctor board certified through his studies at UCLA, and Dr. Darrow uses stem cell and platelet-rich plasma therapy to heal your body. He teaches about the use of stem cells, PRP, and prolotherapy. Today's program could open up a new life without pain for you. To speak with Dr. Darrow, call 866-870-KRLA. That's 866-870-5752. Ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy. Now, here's Dr. Darrow with his co-host, Nita Valens.
Hi there, Dr. Darrow.
Hola, ¿qué tal, Nita?
I feel fantastic. How are you?
Living it up. I'm always living it up, no matter what's going on.
Well, that's terrific.
Very grateful.
I like hearing that.
So, what are we going to do today, Nita?
I think we're going to teach people how to stay out of elective surgeries for orthopedic or musculoskeletal pain, because there's something called regenerative medicine, which has been around forever, but a lot of people still don't know about this paradigm. So they're going to get your free book, your latest, when they call 866-870-5752. The book is called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies.
Yes, it does. And the studies are all peer-reviewed. This is not junk science. This is real stuff. And it took me 5 years to find all this research. But since those days when I wrote this book, there's much, much more research on platelets and stem cells. It's probably one of the most studied areas in medicine today. Everybody is looking towards what platelets can do, what stem cells can do. Can it heal cancer? Can it heal different diseases? And platelets are used for great healing. We just do it for musculoskeletal pain. So if anyone listening wants to talk to me right now live, you can call me about your pain at 866-870-5752. That's the studio. Here we are waiting for your calls. We love talking to people. And if you do call, I'm going to send you a copy of this book. I'm showing it to the camera right now. It's a pretty hefty book. It's about 200 pages long, and it's got the studies on how PRP and stem cells actually do work and how surgery is failing people today. Surgery is the old paradigm. Regenerative medicine is the new paradigm. I'm not saying that surgeons are bad or surgery is bad. I'm just saying that there's too many surgeries being done that, in my humble opinion, I don't think should be done, because we can heal it now with simple injections where you walk in the office, you get injected, and you walk out. You don't need anyone to drive you. There's no real downtime. You just walk in, get your injections, and walk out. And I need to do an examination on you to let you know if it's going to work on you. And we get emails all day from the website, which is www.jointrehab.com, www.jointrehab.com. Every page there has a spot to email me, and I get back to everybody usually the same day. If it's late at night or in the middle of the night that I get these, because I get emails from all over the world, I knock them out first thing in the morning. So I will get back to you one way or another. I like to communicate with people. Every single one of my patients gets my personal cell phone number, and I love communicating with people. We now have Dr. Thomas Grove on staff. He's the same way I am. He gives his cell number out to all of the patients he's injecting. He's really at this point doing all the injections, and I'm managing and marketing the practice and making sure everything's going well. But Dr. Grove is probably, in my opinion, the best injector on the planet. He's had very, very intense training. I never did. I learned pretty much on my own, intuitively. But he came up through the ranks for the last 10, 12 years being trained with ultrasound. He does all of his injections under ultrasound guidance, and you'll love him. He's really, you know, I'll put it out the way it really is. He's a big stud. He's 6 feet, couple 220 pounds of steel, and he played linebacker for the Cornhuskers. He's captain of his football team, and he's a very personal guy. You're going to love him. A lot of people say, well, I just want to see you. And I can tell you he's every bit as good or maybe even better than I am at doing these injections. So kudos to Dr. Grove. So I'm going to go to a question now, if you don't mind, Nita. We also do regeneration of the face. It's called the vampire facelift. And that's a process of regrowing the collagen in the face. When we do it in the musculoskeletal system, you know, we can hit anywhere from the back of the head, neck pain, back pain, all the joints, the shoulders, the ligaments, all over the body, all the joints, toes, arthritis, you know, fingers, knees, meniscal tears, rotator cuff tears, labral tears in the hips, doesn't matter. We can help all those areas heal. But again, don't send me your MRI to see if you're a candidate. You're going to need to come in, and I get people sending me their images every day, and I tell them I still have to see you. The images don't tell me anything at all. And there's studies we have in all the rooms that we hand out to patients to show them this, that asymptomatic people can show up with terrible things on their images. People don't get it. They go, well, my surgeon told me I need a surgery because they did an image. And I ask, did the surgeon touch your body to find out? And the answer generally is no. It's very rare that the surgeon does an actual physical examination. They're very interested in looking at the images to decide whether you need surgery or not. And most of the cases that I see, people do not need surgery. If you've had a terrible accident, you've broken a bone or something like that, you probably need surgery urgently. But most of the things that people have are more of sprains and strains and arthritis and things like that we can heal up. So I'm going to go to a question. This one just came in, and it says, chronic pain of the coccyx tailbone area, excruciating pain. Have had a block with no relief. That's typically a steroid shot, which is terrible for any part of the body. If you look up cortisone and cartilage, you will never get one of these shots. These studies show that when you get these, it actually destroys the collagen, which is the major constituent in cartilage. So people that have arthritis get steroid shots, cortisone shots, and guess what that does to the arthritis? It increases it very quickly. So it's a bad idea. It's the tradition of medicine because it gets rid of the pain temporarily. But what we do with platelets and stem cells is actually regenerate and grow back the tissue and heal it up. So this person said the chiropractor cannot help. Physical therapy does not help. It only aggravates it. I'm sitting and laying on ice all throughout the night and day. Well, that's awful. So the question is, can I help? Can Dr. Grove help you? The answer is I don't know until one of us touches the area and finds out what's going on. We probably would put an ultrasound on it right away and take a look and see if there is some tissue damage, which really can't be seen on X-ray or MRIs or CTs. The ultrasound is live, and it's very, very definitive. It can show little microscopic things almost that are wrong, and it helps us guide where the needle is going. So yeah, we do treat coccygeal pain all the time. That's the tailbone area, lower back, all the time, every day. And it would be great if you could come in and get a quick exam. Usually in about 2 seconds, we can tell you if we can help you just by touching the area. And the phone number to the office, if you want to call in right now and get more information, there's people by the phones. And the number to the office is 800-300-9300. And if you call the office, you'll also get a free book. And we pay the postage, too. So it's a great deal. Let me go to another question here. This is good. This one says, seeing Dr. Grove. I'm interested in seeing Dr. Grove. Do you take insurance? I have pain all over my body. Whoa, too bad. Insurance is a subject we don't talk about on the radio. It's very complex. There are cases where we could take insurance, but we generally don't take medical insurance. But it's worth a call to the office to find out, and that's 800-300-9300. So we get tons of people that have pain, quote, all over. A lot of times people come in with what's called fibromyalgia, and that's a painful syndrome, and it's usually associated with chronic fatigue syndrome. And these are all things that are very complex. Are they real syndromes? Well, some people do have pain all over, and they're just chronically fatigued. But there's usually actually a cause for it. And in the diagnosis of fibromyalgia and chronic fatigue, there's really no studies that show what it is. So you got to dig a little deeper. Very often people that have fibromyalgia do have hot spots. They'll have ligamentous pain, or they'll have pain in the areas around the muscles. There are coatings around the muscle that can become inflamed with overuse, and it's called fascia. I don't know if you've ever heard of fascia. You can look it up on Google. And for those of you that like to look things up on Google, anatomically in the upper left-hand corner after you Google, you will see a spot that says Images in the menu. Just click on it and you'll actually see photographs or drawings of what these anatomical things are, so you can start to understand where your pain is actually coming from. And a lot of times when orthopods give you a diagnosis from an image, when you look that up on Google and you look at the images, you'll see that that's not even where your pain is coming from. And we'll see that all the time. People will come in ready for, let's say, a hip replacement. And the image shows arthritis, but when you touch the body, it's not the hip joint at all. There's so many things that could be going on. It could be a bursitis, a tendonitis around the greater trochanter. You can look that up and hit images and see where I'm talking about. That's on the side of the femur. It's not in the joint. But a lot of doctors mistake that because there may be arthritis. They mistake it for the arthritis causing the pain when it does not. So be very, very careful. I'd be very careful about getting a surgery that you don't need, because the surgeries can lead to terrible, terrible side effects. How do I know? I had one. When I was in medical school, I had a trainer who was having me do deep bench presses with my hands spread wide to build up the lateral pectoralis muscle. And I sprained my shoulder, the right shoulder. I went to an orthopod and one of my professors, and he said, well, you need to get a decompression done. And I was very excited because I wanted to be a surgeon back in those days, until I had the surgery, which made me real bad. My arm swelled up. You people who listen to me know the story. My arm swelled up like a balloon. I had a fever. And it took me 4 years to heal it after that. It was much, much worse after the surgery. How did I heal it? I injected myself. I had my wrist done first after a golfing injury that healed up very quickly. I learned how to self-inject at that point. And then the shoulder, quickly, overnight. That was a real miracle. And people don't heal that fast generally, so I'm not saying this is a panacea for healing. You've got to choose the right person, and you got to have the right doctor doing it. I wouldn't go to a chiropractor to get, or an orthopedic surgeon to get regenerative medicine of platelets and stem cells, go to someone who does it all day long, who has tons of experience. You don't come to me to get a surgery. I was going to be a surgeon until my shoulder surgery. And I was like, this stuff is terrible. Got to be careful with it. So the phone number to talk to me live right now, write it down. If you're in the car, turn off your Bluetooth, pull over to the side of the road if you can and be safe. So the phone number to talk to me right now is 866-870-5752. Here's a person that is, this is terrible too. Person's having low back pain, knee pain, and foot pain. So I am an extreme athlete. I've been working out for most of my life, and many parts of my body are in terrible pain, especially my low back, my right knee, and both feet. So this is common. We get people who are addicted athletes like I am, and we don't stop. Even in pain, we don't stop. And thank goodness I haven't had to inject myself for, I think, over a year and a half when I blew out both my knees sprinting up in the mountains with my husky dogs and then playing a lot of golf. And I'm a very ballistic golfer. I like to hit the ball really far. And at transition to impact, I lunge up at the ball. And people go, well, you're going to hurt yourself. And I go, I know.
But you keep doing it.
But I do, because I just love, I was a gymnast when I was young. In high school and college, I was in gymnastics. And gymnastics is, although it looks very smooth, the actual process is very ballistic. And you learn how to do it so it looks good. But I just love those explosive movements. My favorite thing was the flyaway, where you're doing giant swings around the bar, and then you position yourself in such a way that you literally, from the top of the swing to the bottom, you fall as hard as you can so the bar bends and then flings you up in the air to do the dismount. And that was very, very exciting, but I have to admit I was injured many, many times. And I was young, so I thought I healed up. And it wasn't until I got a little bit older that a lot of those injuries came back. And we find that very often. So for the low back, the major issues that we normally see, people come in with facet arthropathy. That's a type of arthritis in the joints between the vertebrae. Herniated discs, sprains between the ligaments between the vertebrae, and sprains in the iliolumbar ligament, the thoracodorsofascia, and we talked about the coccyx. The person who wrote in before was talking about the coccyx or the tailbone pain, and all of these things can be helped with the right candidate. It's not going to help everybody, and I think the reason that it fails people is they quit too soon, or they're too active. So it's not a miracle cure. It just makes sense. You put cells in that stimulate the body to grow back tissue. So there are images I've taken before and after, let's say in the knee joint, and we can actually see cartilage growth. We see the joint space increase. Now, it may take several treatments to do that, so don't think you're going to come in and get the miracle. Very luckily, my body has been the miracle healing body. Every area that I have injected has healed, and I've done stem cells and platelets on both my knees, both my elbows, my wrist, what else? My neck, my back, my shoulders.
And my neck.
Your neck too, Nita. Yeah, you're doing good. That was years and years ago for you and me. But my most recent was my knees, and that took a while to heal. I put some hyaluronic acid in my left knee, and that was a real wake-up call for me. I never liked to use it because it can cause an inflammation pattern if you hit the soft tissue, where you have to go into the surgical suite to have an incision and drainage because it looks like an infection. So I'm not a proponent of hyaluronic acid. It's a lubricant. Why do a lubricant when you can put platelets or stem cells in that stimulate the body naturally to produce hyaluronic acid? And most people that have pretty severe pain in a joint also have fluid in there. And guess what that fluid is? Hyaluronic acid. So what do? We use an ultrasound. We take a look in there. And if there's fluid, we actually aspirate it out. We numb it up. We take out that excess fluid, hyaluronic acid, and then we'll put in the regenerative medicine cells of platelets or stem cells. Now, this person doesn't get into the actual pathology of their low back, their knee, or their feet. But for the feet, the typical thing is plantar fasciitis, or it could be Achilles tendonitis. It could be many things. It could be the first metatarsal arthritis. We call it a bunion. And there's just a lot of things on the feet or any other part of the body. And that's why Dr. Grove and I have to touch it to find out really where the pain is being generated from. So I'm going to give the phone number out, get some callers in here hopefully so we have some fun. So the phone number, if you want to talk to me live, is 866-870-5752. I'll repeat it. Don't be shy. Use a fake name. Pretend it's your mother. Whatever. The phone number is 866-870-5752. And if you want to get a free consult on the phone with my staff, you can call the office. And the number there is 800-300-9300. And if you want to email me, you can go to the website, www.jointrehab.com. And the nice thing about the website, it's got videos of us doing injections, so you can see if it's something you want to do. You can see the actual procedures that we do of many, many parts of the body. There's probably nothing we don't inject in the musculoskeletal system. The neck, the back, shoulders, the ribs. Very often people have costochondritis. In the old days when people were cracking chests, which they don't do that much anymore, people would get a costochondritis afterwards, and we can inject on the ribs, and that solution will drain down between the ribs. I don't want to put a needle between the ribs because there's nerves and arteries and things like that. But the fluid, if we're going into an area that is what I'm going to call not safe to put a needle in, we can put the fluid right next to it in a safe area, and it will move into the area and help heal that up. So, like I say, there's basically no part of the body in the musculoskeletal system we don't inject. And to me, it's so much fun. I've had a great life over 25 years doing these injections. I've used myself as the guinea pig. Back in the day, we didn't have cadaver classes, where you have a body there that you can inject into with ultrasound and learn how to do it that way. That's the best way. That's the way Dr. Grove was trained. In my day, it was very experimental. And my body was the experiment. I self-injected many areas that I had pain in to heal them up.
So can I interrupt you for a minute?
I heard you breathe.
Oh, that's progress. Okay, I'm still breathing. That's a good thing. Okay, we do have a break in a minute or two, but we also have Teresa and Whittier on hold.
Teresa, Dr. Marc Darrow, I understand your low back bothers you. If we get cut off with the break, do not hang up, because we'll finish up. It's just a short break. So how long has your back bothered you for?
If the injections work, I'm on blood thinners.
No problem.
I'm on Eliquis twice a day.
Me too.
Oh. Oh, my goodness.
Yep. What's the condition you're on for? Atrial fibrillation?
I have two bulging discs. I have osteoarthritis and a sliding disc. Okay.
Hang with us, because you're a very fun person to talk to. You got a lot of stuff going on. So for those of you who want to talk to me live, call the studio right now. 866-870-5752. Call the office for a free consult with my staff on the phone, 800-300-9300. Go to the website, watch these procedures, www.jointrehab.com. We'll get to you, Teresa. Don't hang up.
You're listening to Living Pain.